All right, today we are going to take a journey through one of the most incredible and honestly underrated systems in your body, the gastrointestinal system. Think of it as a winding, complex superhighway that turns your food into the very energy you need to live. Ready to see how it all works? Let's dive in. Okay, first things first, let's just get a sense of scale here. If you could unravel your entire GI tract and lay it out, it would be a mind-boggling 23 to 26 feet long. That is nearly the height of a two-story building. And all of that is expertly coiled up inside you, just doing its job every single day. So, here's our roadmap for today. We're going to follow a piece of food on its incredible journey from the very beginning to the very end. We'll hit all the major stops: the stomach, the small intestine, and finally, the large intestine. Let's start at the top.
Our journey really kicks off the second you swallow. This is the first major stop where the serious work begins, breaking down food from big chunks into a digestible mixture.
First up, we have the esophagus. Now you might think it's just a simple slide for your food, but nope, it's actually a muscular on-ramp, about 25 centimeters long, that uses these powerful waves of contractions to actively push food down towards the stomach. It's a full-on delivery system. And that delivery system leads us right to the stomach. And this thing is a beast. It's not some passive holding bag. It's a powerful, muscular churn. It can actually expand to hold about 1.5 liters of stuff, and it mixes everything with this incredibly potent acid, turning solid food into a thick liquid. So you have to wonder, how does the stomach not just digest itself with all that acid? Great question. It has this amazing built-in defense system, a thick layer of mucus that's rich in bicarbonate to neutralize the acid. But that shield can be weakened. On the flip side, you've got things like H. pylori bacteria, overdoing it on NSAIDs like aspirin, or too much alcohol. Those can break down that protective barrier, leaving the stomach lining totally vulnerable. So when that delicate balance between the powerful acid and the stomach's defenses gets thrown off, well, you can start to feel it. Does that burning sensation after a big meal, sometimes called pyrosis, sound at all familiar? It's a really common signal that something's not quite right. And a lot of the time, that burning sensation points to something called GERD. The easiest way to think about it is like a leaky valve or a faulty gate at the very top of your stomach. This little muscle is supposed to keep a super tight seal, but when it gets weak or relaxes when it shouldn't, stomach acid can splash back up into the esophagus, and yeah, that's what causes that classic heartburn feeling.
Now, if that acid irritation happens over and over again, it can actually lead to an ulcer. And an ulcer is way more than just a little sore. I love the word the source material uses here: excavation, because that's literally what it is. It's like a small pit or a crater that's been burned right into the protective lining of your stomach. And this is where it gets really interesting, because not all ulcers are the same. You've got two main types, and the key difference is all about timing. A gastric ulcer, which is in the stomach itself, tends to hurt more right after you eat. Makes sense, right? Food makes the stomach release more acid. But a duodenal ulcer, which is just past the stomach, often feels better when you eat because the food kind of acts like a buffer for the acid. The pain then comes roaring back a few hours later. It's a really fascinating clue for doctors. Okay, let's leave the stomach behind and head into the next major zone. We are now entering the intestines, which is the longest and, you could argue, the most critical part of this whole journey. This is where the real magic happens. The small intestine? Seriously. This is the main event. It's the longest part of the GI tract for a very good reason. It needs all that surface area to maximize absorption. This is where all the tiny molecules from your food, we're talking proteins, fats, carbs, vitamins, minerals, get pulled into your bloodstream to power literally every single cell in your body. Now, to do all this, the small intestine uses this powerful chemical toolkit. You've got enzymes like amylase for carbs and trypsin for proteins. But fats, they're tricky, right? They don't like to mix with water. And that's where bile comes in. Bile, which is made by the liver, works just like dish soap. It breaks up big blobs of fat into tiny little droplets so the fat-digesting enzymes can actually get in there and do their job. So once the small intestine has sucked out all the useful nutrients, whatever's left over moves on to the large intestine, also known as the colon. Think of this as the final processing station. Its main job is to reabsorb water from the remaining waste material, compacting it and getting it ready for the final step of the journey: elimination. Now, the digestive tract isn't a solo act. Not at all. It has this crucial support crew, the accessory organs. Food never actually passes through them, but without the vital chemicals they cook up, digestion would pretty much grind to a halt. First up in the crew is the liver.
the body's largest gland and an absolute powerhouse. When it comes to digestion, its main gig is to be a massive bile factory, constantly producing that essential fat-busting liquid we just talked about. So the liver's making all this bile, but where does it go? Well, it sends it over to the gallbladder for safekeeping. This small, pear-shaped organ is basically a storage tank. It holds onto the bile and concentrates it, making it even more potent. Then when you eat something fatty, it gives a good squeeze and sends that concentrated bile right where it's needed most.
And rounding out our support crew is the pancreas. If the liver is the bile factory, the pancreas is definitely the enzyme plant. It produces this potent cocktail of digestive juices that contains the enzymes needed to break down all three major food groups: carbs, proteins, and fats.
So we've seen how this beautifully complex system is supposed to work. But what happens when it doesn't? How do doctors actually figure out what's going on deep inside of us? Let's take a look.
Well, when symptoms like persistent heartburn, pain, or bleeding won't go away, doctors need a direct look. And one of the most common and effective ways they get that look is with a procedure called an endoscopy, which lets them see the upper part of the GI tract in real time. And the procedure itself, often called an EGD, is actually pretty straightforward. It starts with fasting for about 8 hours. Then, the patient is given some sedation to help them relax. After that, a very thin, flexible tube with a tiny camera on the end is gently guided down the throat. And that's it. It gives the doctor a direct live video feed of the lining of the esophagus, stomach, and the very beginning of the small intestine.
And the power of this whole thing is summed up perfectly by this quote from our source material. It lets doctors detect or exclude anatomic or functional derangement. You know, in plain English, that just means they can see exactly what's wrong, or they can confirm that everything actually looks perfectly normal. It's that kind of accuracy that helps people get the right treatment.
And that brings our journey full circle. From that incredible 26-foot superhighway that our food travels down, to the tiny camera that lets us peek inside when things go wrong, it's pretty clear that understanding this amazing system is absolutely fundamental to our overall health.
So we'll just leave you with this final thought. We always talk about having a gut feeling about things. After seeing just how complex and intelligent this system really is, it really makes you wonder, doesn't it? What is your gut trying to tell you? And are you listening?